Do you have announcements?
I do. I'm
And
putting
so do I.
Yeah.
Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Lori Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Pickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by our own Tom Spencer. After the invocation, please remain standing for our pledges.
Let us pray. Heavenly Father, we humbly bow before you with sure and certain knowledge that you are with us. You hear our prayers. We praise you because you are good and you want good things for us. We praise you because nothing can separate us from your love and protection. We praise you for you are all powerful and you can use all things for good. We thank you that there is no condemnation for those who trust you. Thank you that you keep your promises forever. Thank you for our families, our children, our grandchildren. Keep them safe. We come before you with broken hearts and ask for healing. We recognize the turmoil around us and ask that you rescue us from the storms. Help us to see the blind spots in our life. Teach us tolerance and respect for our fellow man. We pray for healing and comfort for those who are ill. We pray for those who have suffered loss in the recent crises. We pray for the loss of loved ones and celebrate their transition to your eternal care. We pray for strength and protection for nurses, doctors, and medical personnel and all who protect us. We pray for guidance and wisdom in our efforts today. Open the eyes of our heart that we may see you. For it's in Jesus' holy name I pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state under God, one and indivisible.
Thank you, Tom.
It's not me. I'm not squeaking.
That was weird.
Good morning.
Good morning.
Something from Stranger.
So we have several announcements. We have a few announcements on the agenda
Okay,
this
so we're
morning.
going to see. We went from several to few, so that means it's got to be less than 5.
That's 2.
I'm on your side, GK.
I could use some help.
Me too, GK.
Okay. We can get one more.
It's not on the
Me
agenda.
and you.
So a couple of things on the agenda today. Obviously, we're going to take certain things out of order. We're going to have the briefing on the JPS bond package. That'll be before we get to the administrator's section. Once we do get to the administrator's section, we are then going to move for the briefing. Ms. South is going to come and initiate that discussion. Then Vinny is going to come up and talk with you all, and then we'll go through several other items. I believe that we've given you some additional items in your red folder this morning, and one of those is a memo that you had previously received from Mr. Schaffner dealing with the American Rescue Act, and we'll talk a little bit about that when we get to that particular point. I would like to take this opportunity to introduce someone to the court. We have a new director of facilities management, and the gentleman's name is Marvin Reyes. Marvin? This is Marvin. He came from Spain, 3 days ago? 3 days ago, and he's still a little jet lagged, but we met with him yesterday with the senior team of facilities, and we believe that Marvin is going to do an excellent job for us. So,
Welcome aboard.
Welcome, Marvin.
Absolutely welcome, Marvin.
Okay, that's all we have. Those 4 items.
I wasn't even, there was no revisions. It was just, Just a very small few.
Anything for you, Judge?
Court members, you have before you the minutes of our regular meeting of March the 9th.
Move approval.
Second. We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Do you have any announcements you'd like to make this morning?
Oh, well, thank you, Judge. Yes, I do. I appreciate the question. This past Sunday, we hosted a COVID-19 sign-up event. We did register a handful of folks, so definitely want to thank the partnership with Cornerstone Church in Arlington, as well as our with the Arlington Public Library and our volunteers. We are hosting 2 more pop-up COVID-19 vaccine sign-up events in March. This Friday, March 19th, we will be at Dar El Aman Mosque in South Arlington. And then Saturday, March 27th, through our partnership with Greater Community Missionary Baptist Church in Arlington, as well as the NAACP and Leadership in Arlington, we will be hosting a sign-up event from 10 a.m. to 12 noon. So, of course, I know we've talked about this last week, and hopefully everyone is hearing the consistent message that even if you are not currently eligible to receive the vaccine, that you go ahead and sign up to signify your interest. That will certainly help us in distributing the vaccine as quickly as possible. And then March is still Women's History Month. And I don't have anything eloquent to say aside from all of the women who showed up today. I see you, sis, and keep doing a good job. That's all I got.
What do you got? Anybody else have any announcements?
Yes. Following in the illustrious footsteps of Commissioner Allen, we have our first pop-up COVID registration event in Precinct 1. And we've got them scheduled through when, Roderick?
March 19th and 21st.
Okay,
Oh, through May the 10th.
thank you.
You've been busy, Roderick.
The first pop-up COVID-19 registration event is in partnership with the Potter's House Fort Worth and the Turkey Leg Hunt. Hut.
Yes.
The Turkey Leg Hut. It'll be this Friday, March 19th through Sunday, March 21st, from 11 a.m. to 3 p.m. This event is in conjunction with the Potter's House Spring Harvest Fair, which runs from 11 a.m. to 7 p.m. The registration event will be a drive-through event
At the hut?
Have you had their turkey
on the
yet?
Potter's House campus.
No.
COVID-19 registrations will be from 11 to 3 starting this Friday. So pull up, get a turkey leg, and register for a COVID-19 vaccine shot.
So it was a hut, not a hunt.
It's a hut.
Okay. Just want to be sure we weren't hunting them, we were
A
just eating them.
hut.
You're
I
clear?
can't beat a turkey leg.
How are you today, Commissioner Johnson? You got anything for us?
No, just keep it rolling.
Yes, sir. Court members, you have before you the consent agenda.
Move approval.
Second.
We have a motion and a second to approve the consent agenda. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Mr. Early, I believe, as I heard, was next up.
Right. Members of court, if we could go to the briefing agenda, this would be item 11A. It's the briefing on the hospital district bond package. Mr. Early is here to address the court.
Thank you, Mr. Manius. Thank you, court. I will tell you all, no matter what my presentation is, I truly do miss seeing you all to the extent that we did, and I'm glad we can at least be here, masked or not masked. I've obviously seen a lot of changes take place in the last situation where I see that Commissioner Fickus is parking in Commissioner Johnson's spot. That's revolutionary. And I don't have Jack here. So I have to go to Arkansas to see Jack, and I'm not going to do that. So I do appreciate where we are and what we're doing. Today, I want to give you all an update on the bond package and where we stand and some of the things that are going on. My opinion of the bond package is we are in a partnership with you as a Commissioner's Court, lockstep. You all have constituents. You all have our patients that live in your constituencies that receive their care at JPS, and the expansion of where JPS goes from its buildings and its services are going to be paramount to both this administration and to you as Commissioner's Court. We have an opportunity to pass on to the next 3 and 4 generations the kind of health care that we want to be providing, both in building and in services. Many of us, when we see the value of that and we see those buildings go up, we're talking about this generation, the next generation, and generations to come. There will be buildings that will have people in them that some of us won't even see. With the exception of Commissioner Allen, who is 24 years old, she will probably see those buildings for the next 24, 50 years.
I would never go back to being 24 years old.
But to that extent, I think the decisions that we make need to be done in a contemplative manner and in a smart manner. I know that people have said, well, we passed the bond package 2 years ago. Why aren't the buildings coming out of the ground? And I do realize that, and that is fair. But during this time period, particularly the time period of COVID, I don't think the Commissioner's Court has rested. You've interviewed groups to come in and serve as the program side of JPS. You've done your due diligence to deal with that. We as a board have been meeting. We are excited by the fact that we have a partner in Broadus. We have a good working relationship with Broadus. We work with Broadus on a weekly basis. The other things that have changed during the last year is we have new personnel at JPS. And we have a new vice president of facilities and construction, and the work that he is doing, his name is Adam Lane. He comes to us from Harris County and recently in a stint that he had in Kansas, and he is excellent at dealing with facilities. There was a comment that was made previously that JPS maybe needed to have more. I think Angie Morgan and Lou and our team that we have, Lou Mattingly, our team that we have at JPS have been very, very good. But I think Adam brings a huge level of expertise to that. I think he's had a working relationship with Broadus in the past, and that's been helpful. Where we hope that we go is through a level of high ethics and honesty and openness to the public. We have 2 major concerns: our patients and our taxpayers, and how we deal with that. And what we look at from an expansion of services, both in buildings and what goes in those buildings. The bond package can't just be a building. It has to be the services that we provide in it, and we have to be smart about how we do that. To that point, I know that Commissioner Brooks, myself, Trent Petty, and the judge had a bit of a working group, Mr. Manias, and we would get together to discuss the overall sort of strategic approach to dealing with the bond. I would propose to the court today that we look at one more new element. I would ask the board to make 2 court appointments, and we meet monthly with 2 board members to get monthly updates on where the bond is going. Those are the details of what's happening. What kind of meetings are we happening? Why are we thinking about this or that? Why is it Plan E or Plan B or Plan A? Where are we going with that? I think those quick monthly phone calls or quick in-person meetings would be great. What we would like to do is have 2 board members, and we have some incredibly sophisticated board members. We have board members that have great community concerns. We have board members who have done projects like this in the past. So from the chair of our planning committee, or in the case of Pastor Emerson and Dorothy DuBose and some of the others, we have great expertise from a community involvement. I would suggest that we take 2 of those and take our staff, take Mr. Manias and staff, and take 2 of you all, whichever 2 you select, and we have quick monthly meetings, so you have updates. We meet with Broadus, as I mentioned, on a weekly basis, and what they've structured for us and what they've put in front of us, I think is hugely beneficial. We have looked differently at the funding of that project, and we have accelerated the funding. What we have proposed in our new contract is, instead of initially spending $3.9 million over the beginning of the project, we switched that to $7.9 million so we can accentuate and accelerate the process best we can for design and construction. So we just take that money and we move it forward as quickly as possible. That has been well received by the team that brought us and well received by our team. So we can begin to expedite things as fast and as purposeful as we can. COVID is not an excuse, but COVID did make a difference. It made a difference to you all in the time frame at which you could interview teams to come in and help us. It made a difference for us of physically meeting. COVID also made a difference in our focus, quite frankly. All hands on deck when COVID hit. I looked at my schedule last year at this time. I started my day last year at this time at 6:30 in the morning with a phone call with Judge Whitley. And I ended my day at 9:30 with a call from Judge Whitley. So life changed quite a bit in schedules. And at first, we were a bit imbalanced of trying to figure out how you deal with the virus. But the virus is not an excuse at all. There is no excuse. In fact, the virus, in some respects, has done JPS a favor. When the Blue Ribbon Committee was established and we began to discuss ideas for the Blue Ribbon Committee, and it was a wonderful committee and it's still our blueprint for where we go forward, there was not much of a discussion of telehealth. There was not a discussion of establishing kiosks so people could walk into a kiosk and have a understanding with a provider and talk and take pictures and multiple pictures. The advancements of telemedicine are significant just in technology alone in the last 2 years. But in recent studies at JPS, we have a significant amount of patients who appreciate telemedicine and would rather have some of their initial visits on a telemedicine basis. That makes a difference when we start thinking about clinics. Is that now a 40,000-foot clinic, or is that a 20,000-foot clinic with kiosks established in it? Is it a situation where we put kiosks in our most vulnerable areas where people don't have computer access? Those kind of things are new debates that we've been studying that have allowed this unfortunate virus to give a new dimension to JPS in its care delivery system. So when we look at that, I think there'll be elements that we could not have foreseen 5 years ago or 4 years ago when we began to put the blueprint together for where we were heading in this process. Also wanted to let you know that our emphasis on dealing with the bond package is always going to be, one, not wanting to make mistakes, two, do the right things, spend money wisely. We also want to look at two major key focuses which have never changed from the focus of JPS, and that's community health and that's behavioral health and what we do. And they're both interlinked at various times. When we come up with a new clinic, wherever those clinics go, in all likelihood, there'll be strong behavioral health in all of those clinics. There'll be facilities, and Commissioner Brooks and I have talked about this. People that need quick daily care, people that need their meds, people that need to see us as a partnership for behavioral health can receive that in a community outreach program. And I think that is a much smarter way to deal with your clinics. There is not a part of Tarrant County that doesn't have behavioral health needs. So that's the one thing that is not geographic. When we look at our clinics, though, I think JPS should be in a much better place, and Broadus is helping us with this. I think JPS should be in a much better place in what we deliver. It's not just the existence of a clinic. It's a clinic in the right place dealing with a population and what those differences in that population are. If you take, for example, Diamond Hill and our Diamond Hill existing clinic, and you take our Stop 6 clinics, the comorbidities are slightly different but significant. If you look at Stop 6, you have a high comorbidity of hypertension, blood pressure, and challenges with that. If you look at our Stop 6, we have a higher percentage of those that are diabetic patients. You need to design your clinics in that manner so that you're best serving that population. That may be different than what we put at White Settlement, where you see in White Settlement particularly large growth of an elder population. And you look at dementia and Alzheimer's and those types. None of those are just respective to that area, but the emphasis of the providers that are there, the nurse practitioners, the nurses, the design of the building. If you're designing a building primarily for a higher percentage of dementia patients, that building needs to look differently than some of your other clinics. The drive-in, the driveway, the way up to it, the parking, the way you get in. So that's what we're working with. Our emphasis on behavioral health is still the focus that we've had, and that is to take our 10th floor and move that 10th floor to first floor. 10th floor emergency site patients is a challenge at all levels. So we will be using the expertise of many to try to figure out how to bring that to the first floor and how to bring that to a multiple level facility for longer term care of behavioral health. We hope to have design work on that emergency facility and a longer term facility by the end of the year, and move forward as quickly as we can with behavioral health. Let's talk a second about community clinics, because that's not only dear to y'all's heart, it's a little more challenging. We will frustrate at times when we decide that these clinics should be done in this order, because many of you may say, I want that one first, or my constituents need this more, and we understand that. We're going to try to be as ecumenical as we can and as fair as we can and deal with that. We've enlisted the support of Buxton to come up with empirical data about where the demographics and the movement of Tarrant County are. Can't make those decisions by people just sitting in rooms at JPS. And I can't make those decisions based on politics. I can't make those decisions based on who screams the loudest. We have to make that decision on where the movement of the population is coming from. So we've got some preliminary drafts from Buxton as to where the population shifts of Tarrant County are coming, where JPS's clinics are probably challenged to serve because the existing clinic is maybe 4 to 6 to 7 miles away, and what those demographics look like in the movement of Tarrant County. And I'm happy to share the Buxton report with you all and give you an idea of what's in that report so that you all can take a look. It's one more reason why I think it'd be valuable to have two of the court members getting those monthly updates from us on that kind of information so we can take a look at that. The other things that JPS has been working at and dealing with are issues with behavioral health is our work with you all as a court, our district attorney's office and our sheriff's office and Mr. Manius's office in the creation of a diversion center. We at JPS are strong in a diversion center, and that could be and should be at least linked directly or indirectly to the bond package in some form or fashion, in some way. Our county jail is not the place for mental health patients. And I applaud the efforts of this court, and I applaud the efforts of our sheriff and Mr. Manius, and certainly our district attorney, Sharon Wilson, because they've placed an emphasis on that. They've looked at models in Houston. We've looked at models in Arizona and other places where they have been effective. We've looked at San Antonio and other places. So there has been time being spent on some of the peripheral issues to mental health and the capacity that we currently have. The other thing that we're going to do in this session of the legislature is not particularly the best session, is looking at the possibility of what we do with the state hospital. My hope is to communicate with state officials. Last session of the legislature, there were 6 meaningful facilities being lobbied for to create state hospitals. For those of you who may not be aware, our patients who need long-term care are going to be sent to Wichita Falls. Tarrant County in the west goes to Wichita Falls. To the east, and Parkland goes to Terrell. Both of those facilities are at capacity. The wait times are very lengthy. So getting persons in long-term stay makes that more challenging. You all face this directly at the county jail. When you can't get inmates into the state facilities, it backs up your county facilities. Backs up the county facilities, it backs up municipalities. We face the same problem in mental health. We need to expand mental health services on a longer-term care situation. So the state last session created 4 facilities in the state for state hospitals. Those were wise moves, and they did a good job of doing it. They've incorporated some national experts to come in and help build those facilities. Where I think JPS should be is we should be negotiating and talking to the state about if they want to consider looking at a state hospital in our region. And if it is in our region between Dallas and Fort Worth, where is it? And can it be something that JPS can leverage its bond money with state dollars and figure out how to be more efficient at building a building? For example, and I'm speaking to some degree off the cuff, does the state want to build the building and JPS staffs that building for a state hospital? Is that a shared financial responsibility that is smart for us as a county and our taxpayers? Is it smart for the state to do something like that? I want to begin those initial conversations, and we have begun those initial conversations, to see if there is a proposal at some point to bring back to you as a court to see if that's a smart use of real estate and a smart use of our dollars. Again, figuring out how to leverage the possibilities that we have. So we'll continue in that same area. We're going to have the possibility of looking at capital funds and other funds, that we would look at women's services and other things that we were doing. As you noted in the Star Telegram and others, the disparities and the challenges in the 76104 area and some of our other zip codes, what we do to deal with some of those issues. We've had some meetings with some of our community leaders. We've had meetings with some of our elected officials at the city level to try to figure out what the best either space or services that we can provide for those people who are currently not getting those services. The other thing that we think is critically important as we begin to look at pulling down the first dollars from the bond is the environment at which we have right now with low interest rates. I know that Mr. Manius has talked about this on numerous occasions, and all of us are probably surprised that those interest rates have continued to be low, and actually they're at historic lows now than even they were last year when we said they were at historic lows. The great situation that JPS finds itself in now, both S&P and Moody's have given JPS a AA bond rating with a non-negative outlook. And that's a good place for JPS to be, and it's a good place for us as taxpayers and you all as decision makers in helping us to do that. So the last thing I would tell you is that the recent storm indicated just how far behind JPS is. We were having water leaks at our facility. I don't want to suggest that John Peter Smith, the man, actually put those water pipes in, but there is some belief that maybe he did, because they are old. And when the freeze came, those pipes broke. And I kid you not, as I walked the halls at JPS, literally behind you there would be a water leak. And we had water leaks throughout the organization. It was tough. Some of our other colleagues had water leaks as well. It's hard in this environment when you build a lot on structure up high not to have water leaks when it hits -5. But the water leaks that we had throughout JPS were tremendous. There's nobody that wants to move the bond package faster than you all and us at JPS, because we live it every day, so we know. Again, we just want to make the right decisions. We also had a major gas line leak, and that was really tough. We had to move patients during that time period, and we diverted one case to our friends at THR. And I want to thank THR for allowing that to take place and allowing our patient to be provided services at THR during our time of a major gas leak. The folks at Atmos Energy need to be applauded, because I know during that time electrical utilities and other utilities were taking it on the chin, but I want to say that Atmos Energy couldn't have been better. When we immediately smelt the gas leak, Atmos Energy was on our facility within 20 minutes, and Atmos Energy with their team stayed out all night long and had that repaired within 17 hours and tested within 24. And we got services right back up. So we want to work, we want to try to figure out where we go with the bond and try to make it smart and try to do things right. I know that there is a concern of moving faster. We will do everything we can to move faster, but I want to move right. I want the right decisions to be made. Because as I alluded to earlier, if we make a wrong decision, it's a wrong decision for 30 years. And I don't want to do that. So I think we're going the right approach. I like where we're going with mental health. I like our partner in Broadus. I think they've been a very good team for us, and I think they're working really well. So I'm happy to take your questions or your concerns, both either at this meeting or offline, or however y'all want to do things.
You know, I know that we did have that group, and I think that was very beneficial early on. I think we can continue to have that as you suggested, but I might also suggest that at least monthly you come to the full court and have that briefing or a summary of what
You bet.
what those briefings have been, because I think that's critical. And for the whole court to, sometimes we lose something in the translation when we try to explain what we think we've heard.
Yes, sir. I'd be happy to do that. I can come, the team can come, our construction team can come as well. We'll bring every expert that JPS has.
Well, and I know Broadus has been very helpful to us in the past, because y'all worked on several of our buildings, I think several, or
More than one.
more than one, I guess, is probably, what have we said, GK, what's several?
Several is whatever we want it to be, but yes, they have.
They've worked on several projects for us as well.
Yeah.
And I will say that the Broadus team is here today, and I'm proud of working with them. And Derek in particular, a shout out to Derek. Derek worked at JPS. Derek also volunteers at JPS currently, so he knows our building well, and he knows what we have and what we don't have, and he's seen it for the past 30 years, so he knows where JPS is. Commissioner Allen, even behind a mask, I can tell you have a question.
I generally do. I would like to hear from Derek or someone from Broadus. What do you think is important for us to know right now, since this court hired you?
Thank you, Judge and Commissioners. I think the most important thing right now is we need to get under contract and making sure that that goes smoothly. There's JPS has a fairly lengthy process to go through, and they're working diligently through that. I think next is working through that process so that when not only we work through things and work through the bond program, making decisions, but how we work with the Commissioners Court and getting some of those things ironed out early in the process, so that communication, and then as we start bringing architects and contractors on, that that's a smooth process. The other thing I think is important is being in the community and really hearing what the constituents, their concerns are and what they have to say. I'm a constituent in Commissioner Fickus's precinct, but our office is in your precinct, and I know that we have constituents that are out in the public that are ready to hear and want to give input. And so we have a team that's ready to get started. I think that's going to be important to coordinate that through you and with JPS.
Again, the reason why I asked for this briefing at this time is because, of course, access to healthcare is front of mind for pretty much everybody, right? With COVID being a global pandemic and access to the vaccine being critical, I want to make sure that we are communicating to our public who supported the bond, as well as those who utilize our services at JPS. Here's what's going on. And even when I look at the Yes to JPS website, and this is not for you necessarily, but for Robert and his team, is the last update that I can tell was provided was in October after our court's action. And of course, COVID has been in play, and I appreciate you saying that it's not an excuse, right? It's a legitimate reason. However, we do need to keep things moving forward, which is not to question what's been done, but also we need to make sure we're communicating what has in fact been done and make sure that we are staying on pace and on track absolutely as much as possible. I will say that I appreciate your suggestions, Robert, for how we can resume communicating more regularly about the status of the bond. I've got a group of constituents that stand ready at the appropriate time to provide that input in terms of what are the healthcare priorities for Precinct 2. I definitely want to make sure that we're all staying, that we all have equal access to the information, and of course it's up to each member of the court in terms of their specific level of engagement. I think you all know that I plan to be very engaged on this, on the bond, and what that means for not just Precinct 2, but for the entire county. So, thank you.
Thank you. I would say too that we typically get addressed as Broadus, which is good, but it's Broadus Levis, and our partners very, very important to us. So I just want to emphasize that.
When did Levis come on?
Sir?
When did Levis come on?
They've been a part of our team for even over a year before we even approached and were awarded the project. So they've been a part of our team for a couple of years, and we've done.
I would say we started dealing with you a long time before you were.
Yes, sir. I understand.
Commissioner Burke.
Thank you for emphasizing the other half of the team,
Yes, sir.
the Levis half. I wanted to speak to behavioral health, Robert. I received a delegation yesterday, 2 mothers with adult children with long-term behavioral health needs. They have been active, both of these women have been active with your mental health advisory
Yes, sir.
council. And they pointed out to me that the number of inpatient beds in Tarrant County has decreased even since the Blue Ribbon Committee's report. I bring this up to point out the urgency of the mental health crisis in this community. There is nowhere to put people who need inpatient care for short periods of time. Trinity Springs is overloaded. Other hospitals who served that population have closed their doors. The state, through its mental health hospitals, is more focused on competency restoration than they are on treating people in our communities who have mental health crises. The situation could not be more dire. So I want to encourage you to put on some speed, and let's get the new Trinity Springs planned and built. No one is going to serve that population if we don't do it ourselves. It's not a profit center that would benefit private organizations, it seems to me. So we're going to have to provide those beds ourselves. And those inpatient beds, as you mentioned, are only a part of the necessary mental health infrastructure for this community. We need the diversion center. Mm-hmm. We need community-based care and maintenance in our medical homes that we propose to build. It's a system which we don't currently have. And it's urgent, and 2 years is a long time.
There's a couple comments I'd give to that, and all appreciated comments from you, and I know you're concerned for mental health along with other key areas of comorbidities. I think that when you look at elder care and you look at certain comorbidities, there are pockets of the county where that is stronger and that has a difference. When you look at behavioral health, it is countywide. It is nationwide. It is statewide. Tarrant County is not the only one in this situation. I just hope we have better answers to deal with it. It is JPS's responsibility, and it is a strong responsibility. It is my hope that this community will also see the philanthropic need to help offset government dollars to figure out what we're doing. And to that point, and you know this because you and I have talked at length about this, if we build a building and we don't have the proper case management, if we don't have the individuals that go to that individual's home, if we don't help them, we will just have a building. And what's interesting about JPS, and one reason I appreciate it so much, is the dichotomy at which JPS lives and the people that we attract for caregivers that come to JPS. Because we're a level 1 trauma center, we're going to attract people who want to save a life within seconds. The doors swing open of a trauma bay, and we have a swarm of people to put that person back together, and we have seconds to do it. The people that met with you, we're creating both with their families and the individual a hopeful 60-year partnership, or a 70-year partnership, or from cradle to grave partnership that we can have with them. That takes an incredible amount of work, trust, and appreciation, not only for the patient, but the patient in us. Because as you well know, when those individuals go off meds, it is a breakdown. It is a problem. If we can maintain that life, if we can go just the opposite of what we do in a trauma center and begin to maintain, we make a big difference. So to me, in my personal interest in mental health, it's important, and your words are definitely heeded, and I appreciate them.
I do want us to work and do whatever we can during this session of the legislature to see if we can obtain from them the same funds that I know Harris County,
Yes.
Bexar County, and I don't know whether Dallas got one or not. But
No. Harris County, Travis County, and Bexar County in particular received funding. They were basically state winners from last session. The state has begun to redesign its strategic plan to long-term care facilities, and JPS has been in the middle of those discussions, but we'll continue to do that.
I know that we have 200 plus prisoners sitting in our jail today that are waiting on competency assessments and or becoming competent, many of which it's already been determined they would not become in time, and they need a hospital bed. Not a prison, not a jail bed, but a hospital bed.
I agree. We can have stronger answers in Tarrant County, and I think we will. So
Robert, in your recommendations for how we'll meet the updates that we'll get to the court, and then also the meeting of, the list of folks that you suggested, I think at a minimum that we need to make sure that there are updates to that Yes to JPS website, and that can come after whatever, kind of the high level bullets are, just so we are keeping the public informed, until things, pick back up in a faster pace, until we get to the point to where people can see with their eyes, the results of the bond. I'd also add that I think it's really important that we are communicating about it, especially if we're talking about a proposed transportation bond. If I'm a voter and a taxpayer, both of which I am, and in our county, everyone is one or both, I'm going to say, well, what did I get from the last bond that I gave you guys, right? So obviously, the entirety of that doesn't lie on your shoulders, but the point that I'm trying to make is that we can't keep asking for voters and taxpayers to give us resources to do work if we haven't been able to adequately prove up this is what we've done with what we've given you so far, so.
Yes, ma'am. I appreciate the comment, and I agree.
Any other comments or questions?
One final question. Do we have a contract yet with Broadus Levis?
The contract goes before the Finance Committee on the 25th. It goes to full board. It's April 10th or 11th meeting, and then it'll come to the court. And that's just been a process of making sure that we were on the same page as Broadus Levis, and we were on the same page as legal. And so we are all on those same pages. I don't know of anything. We're moving ahead. It will go to the Finance Committee. It's already done. It will just go to Finance and go through its regular procedures. The last thing I'll say, if I have my time, and I apologize to J.D. Johnson, who wants, I understand, I see his face, and it's like, be brief, Robert Early, be brief. But I do want to say that I am thankful for the efforts that public health has done in the efforts to vaccine. And I am extremely proud of JPS in its diligence to continue to provide vaccines. We're at 51,000 vaccines that we have provided. So we've seen a lot of arms at JPS. And I'm thankful for the state in continuing to provide us vaccines. And I'm really proud of the role that JPS has played in particular being able to, in tough times, provide vaccines to Arlington or provide them to the FQHC, and to take some of that list that Vinny has, which is extensive, and be able to bring some of those people into JPS, and then trying to get some of those to other workers and other places in Tarrant County. JPS will continue to do whatever it can to get as many people vaccinated. It is, in my opinion, and in the opinion of the doctors that I work with, the right answer. And I think we're doing the right things. Us as a community and us as JPS. So I want to thank you all, and thank you for allowing me to have weekly phone calls with y'all, although sometimes they go amiss because of schedules. But I appreciate the weekly calls that y'all are willing to have with me so I can give you updates. I know there will be a time that you want COVID done for two reasons. You want it to be done because we want a safer community and you're tired of COVID, and you're also tired of talking to me on a weekly basis. So both of those, when COVID leaves, will be a treat to all of you. So
Thank you, Robert.
thank you all very, very much. Mr. Manius, thank you.
Okay. Members of the court, we're now going to go to the administrator section on item A1, South.
Megan, while you're waiting, Mike and Tracy, y'all kind of confused us. You know, we look around the court, we expect to see people in their places, y'all's places along the back wall. Mr. Reyes, I guess they're giving you full support today by sitting there with you. They'll tell you you need to be sitting them on the back wall from this. Now, see, Melissa also, but she explained that she was not going to sit where Jack was. Where'd she go? Melissa just got up and left.
Megan, how are you?
Good morning.
Good morning.
Good to see you all again. So let's go ahead and get started with our pillars today. Maybe. Oh, Lonnie, you might have to go back for me. Thank you. So just a quick update on the pillars, specifically the social services pillar related to the Federal Emergency Rental Assistance Program. That is now in the software implementation and training phase and should launch in the next couple of weeks. And also on the Texas Eviction Diversion Program, there's 45 active referrals. So I think last week when I updated there was 27 maybe, so that's gone up. And just a note that all 8 JPs are actively participating in that program. And at the end of my presentation today, Janet Ditton is here. And she will give a quick and brief presentation and more in-depth of that particular program so you know where we stand. Moving on to our vaccination update this week. So as of March 15th, the county and its partner entities have administered 342,962, with public health administering 163,924 of those doses. I know Robert just said that JPS, he gave the number, I think it was 54,595 doses as of yesterday. County still has the capacity to provide the 91,000 shots per week. And then last week I gave you an update related to the transportation access for vaccination sites, specifically for Trinity Metro. So the ridership was not as high as they had hoped for, so staff has started a targeted outreach. Did you say something, Judge? No?
Not yet.
They started a targeted outreach to increase the awareness of the Trinity Metro services to Arlington, to the vaccination sites. So in 2 weeks, we're going to reassess the ridership numbers and go from there based off of those numbers. Any questions on that?
Yeah, because I would assume that at some point it's going to be almost better to just Uber them than it will be to run a bus back and forth from that perspective.
That's correct. The
Because-
bottom line is that we want to ensure that the transportation is available to everyone.
One, through the current agreement, like folks have to leave from 2 different locations on the Fort Worth side, right, in order to ride over. So I wonder if that's maybe why we're seeing some of the low ridership.
I don't know.
Yeah.
Yeah, I think
Yeah.
they're still looking into the reasoning behind that, but I know
Sure.
that they're going to try to increase that in the next couple of weeks, so.
That's probably part of the problem. The
Yeah.
other part is that people just don't know that the service is available.
Yeah.
One of the flyers or something that went out indicated that there was free transportation to everything but the THR sites. That was not, what was that about?
Kristen, do you know anything about that?
Did we ever find out anything about that? I have someone that can give us, I think she can actually produce the copy that showed that.
That would be helpful. I've looked at all of our outgoing communications, and there was no mention of anything. Talked with Deb McNamara this morning, and she's also not aware of that message being sent by Catholic Charities. So if you do have a copy, I can look into it further.
I think I can get it.
And then I did put the website out there again. I'm hoping people will pick that up and look into it or spread the word more. So just so people know, it is tarrantcounty.com/vaccine rides. And then lastly, a quick update on the call center. Hopefully maybe the last update on the call center. So since we last spoke, Grupo has since added 11 agents to cover both vaccination lines, since they now are operating both. So that's a total of 61. They also have 20 more agents that are being trained to address the call volume. I think it's higher than they initially expected it to be. So we'll have approximately 81 agents, I believe, by March 29th, working that call center. And then on this last slide, which is also...
Megan, do we have enough lines for them to use?
Yes, so it's...
Telephone lines?
Yes, and so it's when someone calls, it's just the first option 1 is the vaccine-related line, so they only have to choose that one line, and that goes straight to Grupo. So I think that they're staffing up. I think they might have underestimated the amount of staff that they needed, so they are staffing up, though, to cover everything.
Okay.
And then in y'all's red folders, there is a copy of this map, but this is the map that Commissioner Allen had originally requested. So this just shows the volume based off of zip code. I know that this doesn't give you a number for each zip code, but if you were to look at the actual data that's provided, it would still show you that the 76107 area is still the highest call volume by probably 80 calls or so. It hasn't really changed much based off of that last top 10 report that I had provided for y'all last week. Any questions on the map, or is this okay moving forward to provide weekly? Anything different you would like to see on it?
I'm going to think about that.
Okay.
I mean, I know I specifically asked for this, but I'm going to think about that.
Okay, let us know if we can-
Circle back by next week.
Perfect.
Thank you.
And then the last couple of slides are just the quick notes on the county grant and spend update. There's no substantial change on either one of those, so I won't spend time going over them, but we will continue to put them in the packet for y'all's reference. And then Janet's going to go ahead and come up and give her presentation, as long as you don't all have any questions for me.
Where are you, I know it just passed last week, but are y'all beginning to look at the new ARP Act that was passed?
I believe that's Russell. Yes.
And that had an additional,
We'll be talking about that in just a second, Judge.
okay, that had a lot more money in it for us, I think about 24 million
Correct.
more.
So we'll start seeing changes on these slides as that progresses.
Okay.
Thank you all.
Thank you, Megan.
Good morning.
Morning, how are you?
I wanted to refresh you all a little bit on the program that we have put out since February 1st. What we've been doing is it's a last resort program to prevent evictions, to get landlords made whole, and to keep people in their homes. And the way we've been handling that is developing processes and relationships with the JP courts. And they have been very wonderful to deal with. And we're reaching out, and not only have we been developing processes with each of the courts to suit what their needs are, but also to make some uniform processes to make it easier on them to encourage, as much as a judge can, landlords to look into this eviction diversion process. But they've also set up, we've had several community forums with landlords via Zoom, and we've had 50 or 60 landlords on each one through the JP courts. And when we do that, we found that those referrals go up, because what they're finding is we're providing a human interaction and part of that service that you can't always get when you're making online applications and that kind of thing. So Tarrant County we're offering them some good service, and that's where we're seeing some of the results. I think we'll get even more referrals, but right now we are just about to get to that point where we've got the payout process, the application process down. It's not easy for lay people, and there is quite a bit for tenants to do in order to get this eviction deferred. But there's a lot of benefits to it, and once we explain that to them, they're really cooperative, and we've been working with them. So that's been one big thing, a great silver lining that's also come out of this that I think will go long into the future. JP Court 1, Judge Swearingen, has come up with an idea of being able to look at where those folks are who were affected by the moratorium, meaning those evictions are just sitting there because the CDC moratorium stopped them from happening. Well, when that gets lifted, there's some concerns as to what kind of explosion that's going to cause. So we're trying to get a process down to try to investigate those in advance, and then work with those folks to get them remedies, and still try to keep the evictions from happening as we can. Part of the problem is not knowing what's out there, and there's a lot of funding that's coming in, and Kristen is working feverishly to make sure that gets as automated as that people know about it, so that we can get this money to where it needs to go. And so we've got more money coming, and that's really hopeful for us, and then working these processes to get ahead of it so that maybe we can keep people from losing their homes. And that's about the state of it at this point. We're still working with the JP judges and keeping them informed.
Well, I want to thank you for what you have added to this process. From my discussions with the various JPs, it has been extremely valuable to have somebody involved in the process with mediation experience, to work with the landlords, to work with the tenants, to work with the courts themselves. So you've made this thing a whole lot smoother, and I thank you for that.
I would echo what Commissioner Brooks has said, that I've heard good feedback on it. I would say, I guess maybe a week before last, I've presented on the work that's being done here in Tarrant County by way of the various rental assistance efforts to the Conference of Urban Counties, and also through NACO and with the Aspen Institute, and people are definitely paying attention to what we're doing here. Like, I know that that there's a lot of work that needs to be done yet, right? And even with more dollars coming in, really that just speaks to how big the need is, but I think we're on the right track. So thank you for your efforts.
Yeah. Well, I have a great mentor, Kristen, back there. Is really good. She's really good at catching me up with those hard details.
Thank you.
Anything else?
Thank you very much.
Thanks.
So, Your Honor, what I think we're going to do, we're going to now go to Mr. Snage's presentation, then I'll circle back to talk about the American Rescue Plan.
Okay.
Good morning, Your Honor, and members of the court.
Good morning.
Morning, Vinny.
We need to look and change that slide out.
Right. So just a quick update on situational awareness for COVID. We're continuing to trend down in Tarrant County. We have 247,000 total cases. And just a reminder, we did just pass 1 year. I think March 13th last year were your first orders that were issued. So we're just past that. A lot of damage in the community, obviously, with COVID, but still, I think the goal was to survive, and I think we've survived and get there to where vaccines are available. There's some more good news on the horizon. There are some promising antivirals coming out. In the next few months, I think we're going to see an oral antiviral. They presented phase 3 clinical trial data. Looks very promising. So it would be very similar to what we deal with the flu, the Tamiflu type of situation where you can take a 5-day course at home and treat COVID at home. So that's all good news developing. I think a lot of positive developments there. Our deaths are still there, trending down, but we have 3,138 deaths in Tarrant County that are reported. Hospitalizations definitely coming down. We have 270 people in the hospital with confirmed COVID. That's a 5.72% number for Tarrant County. That's compared to total available hospital capacity. And then 65 people in the ICU. That's about 17% or so of ICU capacity. Good news is there's now 82 ICU beds available, and I think that number is growing, as you can see over the last few weeks. I think we got down as low to 6 beds at one time. That was pretty concerning, but this is a good number to have on hand. TSAE is also declining. That's the 19-county region. We're at 846 confirmed cases in a 19-county region that are inside the hospital or hospitalized. That's again a 5.39%, and 231 ICU beds are available. I want to point out the map, the 19-county map is pretty much all green except for Rockwall County. I think being a smaller county and maybe not having as many hospitals and beds available, they were in the orange, and I think they went back to the red this past week. So hopefully it's just a fluctuation, and they'll get back to the trend with the rest of the region. One of the concerning pieces is there that spring break is here. Of course, the message has been stay home and enjoy, but of course, people are tired of staying home, and here we are enjoying spring break. I feel better that there's low COVID case trends happening and a vaccine is here, but at the same time, this is what keeps me up at night. People gathering with no masks, social distancing is not really possible with large crowds. So the scene on the left is from Florida, people from all over the country visiting. And then the two coverage articles are from Texas. One is from Fort Worth, obviously. You can see the stockyard sign and the streets packed. And then the other one at the bottom is Galveston Beach. So, we'll see what happens after spring break. But again, caution's in the wind. We're not out of the pandemic yet. Italy, India, and some other parts of Europe actually, are also starting to experience a third surge. So it could happen here as well. That's just the nature of how this goes. So we always, till we are done with the pandemic, we need to be careful. And these are the things that we need to be very, very careful about. If we congregate in large gatherings with no masks and no public health measures in place, there is a chance that there will be some more cases that will come back and occur. But overall, trend situation, like I said, is improving very significantly. We did hit a little bit of a flat plateau, if you will. Hopefully we'll resume the downward trend, but if you look at the left, the decline has been pretty sharp and sustained, and that's great news. On the right, the death counts are again trending down as well. Here's all the charts. The one on the top left is the 7-day moving average for case positivity. We're down to about 6%. I think 5% was our pandemic low back in May last year, so we're approaching that. I got a little worried last week because we had hit 6% and went back up and stayed there for a few days, and luckily we're coming back down. I thought we had hit the bottom. So that worried me a little bit because other indicators were starting to do the same. The case rate had come down below the red zone criteria. We were at 81 per 100,000, and then we went back up to 154, 158, 159. So it got me a little worried, but I think we're back below the 100 mark, and we're at 94 per 100,000. COVID-like illness, which is the chart on the right top hand corner, it's still trending down. We're pretty much at the bottom, I think 2% of CLI. The blue line at the bottom is indicating flu activity. We're still in flu season, even though it's kind of late, but you can see flu is there. It's it hasn't disappeared, contrary to a lot of, arguments. It's there. And we've had people that we know here in the community that have had the flu, and some were flu and COVID combined. They got the double whammy. So what should we continue to do? The message hasn't really changed. Order or no order, these are the right things to do. Wear a mask, maintain a 6-foot distance. And there's some news developing that CDC is reviewing data. They may come back and say, okay, now it's safe to reduce the distance to 3 feet. But officially that guidance is not here, but a lot of media coverage about it, that they're contemplating that. Avoiding large gatherings, that's just a standard. As long as the pandemic is there, let's not gather in large numbers because you never know what's going to happen. Somebody may be ill. And then continuing to wash your hands throughout the day. So those are the main messages that are still true. And they still work, and they work in conjunction with having vaccines and having antivirals. At some point, the numbers will get low enough that we won't have to worry about these things, but currently we're not there. So here's the update on our vaccine schedule for this week, and there's some changes. So for the Resource Connection site, we're running a half-day clinic all week this week, 9 to noon. Partly is because we did open up Farrington Field for 5 days as a full drive-through. So Farrington Field is running Monday, Tuesday, 9 to 5. They're off on Wednesday, and then Thursday, Friday, and Saturday, 9 to 5. The Hearst Conference Center location is going to open Tuesday through Saturday, 9 to 6. And then Bob Boland Public Safety Building is only open on Wednesday from 9 to 5. So that's the Tarrant County Public Health sites that we're operating. Partner sites, there's some changes as well. As you're familiar that in Arlington, there's the FEMA site at Globe Life Field. They're at the end of their first phase. So today they're only open 9 to noon. And then tomorrow is sort of their end of the 3-week first dose cycle. And they're open 9 to 5, but sort of running low traffic. I think their goal is to do only about 2,000 tomorrow. And they would have exceeded their goal of 63,000 first dose vaccines. I believe we were already at 61,000 and some change at the end of yesterday. So they're looking to wrap that part up at Globe Life Field. And then on Thursday, they're going to switch to East 4 Stadium, which was the site where Arlington Fire Department was running their main operation from. And then for the next 3 weeks, they will be doing second dose vaccine out of that location at East 4 Stadium. So that's a change in venue. I think it's been communicated, and we just want to make sure you all are aware as well. And then the drive-through site at TCU, which is a Baylor operated site, they still plan to run, I believe, on Saturday from 9 to 5. And then the only other thing is that you've heard us, talk about our partnership sites with the MedStar. They run these mobile clinics at different locations. This week, due to spring break, they're not running any of those, but they'll be back, I think, the week after. So here's a quick update on what's happening with the vaccine. And again, this data is from last Wednesday, March 10th, so a lot more has happened. We'll have a better update on our dashboard tomorrow. It's just how the files come into us from the state. But as of last Wednesday, all across the county, this is all providers combined, 436,000 or so doses administered, out of which 94% again were Tarrant County residents and 6% out of county. And 278,000, or about 13% of the county, received at least one dose, and then 155,000 received their 2-dose series, so about 7% of the county has completed their 2-dose series. The maps we've talked about, there are improvements in certain areas that we know we're sort of falling behind, but again, the work needs to be done. Again, those areas are going to take a while to catch up. So that's where we are on those.
And again, this is just Tarrant County Public Health.
No, sir. This is, let me get back there.
That's what it says at the top.
So it's our dashboard, but what we're presenting is the amalgamated data of what we received from the state. But as you and I have talked several times, their data is behind. So then whatever we know, we sort of fill the gaps to give a most composite picture, because nobody else has that picture. The state dashboard doesn't show it. We don't have local data from partner entities. So what we're doing is taking MTRAC data and then adding our data on top to get us the most complete picture that we can see.
Does our data have zip codes?
Yes, sir.
Okay.
Yes, sir. We have everything, the zip codes, ethnicity, because we are required to report that to the state, and a similar format comes back from DSHS. So just to point out, I'm sorry, let me get back. So the map on the left is zip code breakdown, and the map on the right is city breakdown. So as you can see, we have that color-coded, and the coverage is available. So here's registration data out of our database, and I know we're going to talk a little bit more about that today. But this is where most of the signups are occurring from. Of course, the colors are improving. We're getting deeper and deeper, darker shades. But we're certainly needing more in central part of the county and eastern part of Arlington. So more central, south central Fort Worth, northwest Fort Worth, more sign-up efforts needed. But things are improving overall. As you can see, there are about 80% of the folks in our database that are eligible at this time because of all the categories 1A, 1B, 1C. That means there's 20% or more that still could be eligible as more categories become open. Quick update on the demographics. So age groups on the left, and then I think next week's update we're going to split it up to show the 1C category, 50 to 64, so that will be a little bit more visible. Improvements happening on the race ethnicity coverage, not to the level where we are from a population representation standpoint, but like I've said, every percentage point that we move, the denominator is huge, so we're making good progress. So African American coverage is now at 8% of all the people that have been vaccinated in the county. And I know we started at about 5, and
That's a good improvement.
yes, sir, it is a good improvement. Again, is work needing to be done? I mean, as a county, we're at like 18, 19%. So, we need a lot more effort there.
And one of the reasons for that improvement in the African American rate is the event that they had at Mount Olive Baptist Church, Fort Worth, last week. They did 794 or so shots, and they had a line wrapped around. Their building covers the whole square city block. They had a line wrapped around that entire building for most of the day.
Yes, sir. And I want to give also credit to the FEMA site being here. I've been looking at their data. So out of the 61,000 or so, 11% were African American. So that's almost like 6,000 plus in that site. 21% out of those 61,000 were Hispanic or Latino by ethnicity. So that's a huge improvement. I think that gets close to, the overall county is about 29% Hispanic Latino by self-identification. So that was a good representation out of that group. So again, efforts are underway. It's going to improve the numbers overall.
It is possible to make improvements if you make concerted efforts.
Absolutely. Absolutely. And the sign-up efforts that are happening in the county, I want to make sure that people understand. I know Commissioner Allen has done some. I know you've started some. The judge has, talked about getting some things started. There have been community partner organizations that have organized events in 76105. So all of those are starting to bring some fruit. And we see that in our data. Sign-ups are improving, and as a result, vaccine rates are going to improve. So the next slide here was a request to sort of, because people get confused when we show the dashboard, that is an amalgamation of what's happening in the county. And, We have a separate registration, obviously, you know, through our site. What is happening with our data? Because we have public health sites, we have a partner site in Arlington, and then some partners like THR, JPS, and others work off of our list. So the request came, can you show us what is happening, who got done, who is left? So the next slide is full of numbers, so my apologies, but I'll try to walk you through as easily as we can.
So,
Yes, sir.
take a breath. Let me just, we've been working on this. In fact, we finished the slide. You finished the slide at 12:15 this morning. And so we've been working on this. We know we need to improve this particular slide. And our goal is to give as clear a picture as possible of those that have registered, how many have been duplicates in there, some may not have wanted shots, some have received their first shots, some have received their second shots. And I know it's somewhat complex.
It is.
And we're going, I will assure you, we'll be working on this thing this week to make it somewhat clearer.
Yes, sir. So just as Mr. Manius explained, a lot of things, you know, happen as people sign up, and you've heard me say before, there were a lot of duplicates. People signed up multiple times. So the efforts have been underway. Total number of people that, and I've kind of rounded off these numbers so people can understand, it gets really complex. 881,000 total signups occurred, out of which 93,000 were duplicates that we removed, right? So that part got deleted because there were multiple registrations sometimes by the same person. So that leaves 788,000 registrations in our system. That's the number I quote when you ask Vinny how many people have registered. That's 788,000. So then a couple of weeks ago, as you saw after the snow week, there were, you know, a concern about a poor show rate, and the effort was, okay, let's find out who wants to cancel. Have we found a way to record that? Yes, we did. So since then, about 133,000 people have answered, because we run these weekly surveys, that they want to cancel off our list. So we take those out. And then, of course, questions came, well, people got vaccinated somewhere else. Is there a way to find out and get them off of our list? Yes. Is it 100% accurate? No, because we rely on M-Track data. It may not have everything up to date. But we found that about 16,000 were a match in our registration setup, so we took those out. That leaves us with 639 active registrations. So that's one number to kind of start with. So if you look at the next box, and I've tried to color code those so we can follow along. So 639 active registrations, now there are the eligibility criteria, whether they're currently eligible or not, whether they're 1A, 1B, 1C eligible. So that was 84% of the people, 534,000, are currently eligible. And 97,000 are people that would be eligible at some point in the future when other categories open. And then there's about 8,000 that our system is saying, no, they're not eligible. And we're working through that data, but some people they put 2021 as a date of birth. Some have date of births that are in the future, you know, things like that. So we're cleaning that up, you know, trying to make sure we work through there. But for all practical purposes, 534,000 was the work that we need to do today, right? So out of that, how many have received an appointment? And let me explain what that means. That means that whether we've given them an appointment or we gave them an appointment at Globe Life Field with FEMA or the Arlington site, or we transferred them over to THR or JPS as a partner entity or Baylor. So 477,000 people, in our view, have been given an appointment through our system. Not everybody comes, and you know, that's an issue. But then what is left is 57,000 eligible people. So that's technically about a week and a half worth of work really left to do if nothing else changes. Now with more categories open, sign-up efforts happening, this is a floating number, right? Every day, 10, 12,000 people register, so the number could grow. But I wanted you to understand that we've done a lot of work. Almost 89% of the eligible registrants have been called saying you're eligible for an appointment. Now, 11% remain. So far with me, because I know that's a lot of numbers. Okay, so out of the 477,000 appointments, here's a breakdown on the left bottom corner. what was done or given by public health, or the Arlington and FEMA site, or a clinical partner. So as you can see, 185,000 appointments were issued by public health alone, including our 4 sites. So that's at Hearst, at Resource Connection, Bob Bolin, and Farrington Field. Those are the sites that we help operate. 170,000 appointments were issued by either, well, at Arlington's Eastport site or the FEMA site, and we send those call-outs on their behalf. So that's that. And then 122,000 registrants were transferred to a variety of partners. So THR being the biggest one. Baylor Scott and White TCU drive-through. We transferred some to City of Colleyville Fire Department because they get their own vaccine. We transferred some to Burleson because they got their own vaccine. So there's smaller ones in there too, 1,000 here, 1,500 there. All of that accounts to about 122,000. So then comes who has administered how many doses out of the appointments that we sent out. So I want to tell you that we have a very clear picture, of course, what public health does, and we have a very good picture of what Arlington/FEMA is doing. The partner transfers don't always come back to us because they're usually independent providers, and they report out what they've done to DSHS through MTRAP. Now, we've asked for that back. Occasionally, we'll get a file or 2 back, but that's the data that's sort of unclear to us also. I mean, as you can see, it shows only 34,000 doses administered. Well, obviously, that's not true out of 122,000 because that's been done over several weeks here. But what we can tell you is public health has given 104,000 or so first doses and about 62,000 or so second doses. So total about 166,000 doses administered by public health alone. And then the Arlington FEMA combined effort, so esports and the Globe Life effort combined, 108,000 first doses and about 41,000 second doses for a combined 149,000. So that's the bulk of the effort. But if you look at it, how many people got through this public health registry, if you will, their first doses or second doses, what we know is 237,000 got first doses and about 112,000 got second doses. So that's a total of 349,000 doses administered so far. Despite all the challenges with not having enough vaccine, I think over time the effort has been pretty sustained and it's gone fairly well. So I know that was a lot of numbers, so I'll be happy to slow down and explain anything that you might have questions with.
The only question I have is where are we accounting for Johnson & Johnson since it's just the one shot?
Yes. So currently in this chart, I have lumped it in there, the first doses only.
Okay.
But that was just so that I don't keep confusing because it was just going to get too big. It's not a big enough number. I think the total was 4,600 or so that were administered so far. And that is what I know because that's the FEMA site in Arlington that had received the vaccine. Now, if you go back to our chart here,
Yeah.
we are going to relabel some of this as Johnson & Johnson data starts to show up, and it gets very confusing. So it's going to be recorded on first doses given because it's a 1 dose, but it's also going to impact, we're going to relabel as people who have completed their series. So there's going to be sort of a double count there because they're sort of independent of each other. They don't necessarily all jive together because now you've got a 1 dose vaccine. So next week it's going to look a little different. It'll be mostly relabeled. But for today, we've got it included here under the Arlington FEMA first dose numbers.
Okay. And that was going to be my question is when were we going to start to incorporate that into the dashboard? So
Yes.
next week then?
Yes.
Okay.
Any other questions?
Okay, I just saw this, and so I'm not even gonna begin to
Yes, sir.
CPA you to death.
Yes, sir.
But I would call your attention to the 788 registrants.
Yes, sir.
Go back about 3 slides.
Yes, this is data from yesterday evening. That data is from last Wednesday, 718,000.
Okay.
So that's a weekly snapshot, and this is like live as of last night when I was working at close to midnight. So it's a live system, and numbers change all the time.
And the live system right there.
This one is not live. This is a weekly snapshot for
When is
public
that
view.
weekly snapshot?
Yes, sir.
When is the weekly snapshot?
Wednesdays, we update the dashboard every Wednesday.
Okay.
Yes, sir.
We might update the dashboard, I mean, right before court as opposed to it being a week later?
That's what I was hoping. So our goal was to get it updated every Monday, and we tried that for a few weeks. And then the state file, even though the date is Monday, it really was showing up on Tuesday afternoons, and we're like, okay, well, get the latest data. Yes, I know, we've had that issue.
Okay.
Yes, sir.
But yeah, so if this was perfectly accurate and we'd been looking at it for months, and we were very comfortable with every one of the numbers, as opposed to this being an ease, you're telling me that we have 57,000 people as of last midnight this morning.
Correct. So, and
57,
how?
well, just a second, let me
Yes.
finish. I want to be sure everybody understands that we have 57,000 people registered who haven't gotten an appointment yet, and not 788,000.
Correct. Yes, sir.
So what that says is, folks, register.
That's right.
Because we could very easily go through this 57,000 in 1 week
Yes, sir.
if we got vaccines, or, I mean, we just need to really stress how important it is for everybody who wants a vaccine. Now, ain't no use in registering if you're not gonna come get the vaccine when we call you.
Yes, sir. And the message is point on. The point of all of this is people need to register, especially now that the Category 1C is open. 50 to 64 is about 285,000 people, regardless of health condition. That's just Tarrant County. And you know we're taking registrations from everywhere. So we haven't seen that many people register in that age group is what I'm saying.
And the other thing that I have a little problem understanding, if you look at first doses, we show 237,000 under doses administered, and we're showing 477,000.
Those are just appointments, and the way the appointments are recorded in our system is that even if we transferred, let's say we transferred 25,000 names to THR, that's going to show as an appointment given in our system. It says transferred to THR. That's their appointment status. So after that, THR actually issues the appointment all week long. We don't always see that data back.
Well,
but
does
that's
it
just
mean
how,
that every time we issue them the first, I mean, because we've only, well,
yes.
I'm just not gonna beat it to death today.
So I think when we talk about, let me help on this.
Well, I mean, there's just
No,
477 to 2, that's too big of a difference for it just to be.
What we wanted to do today was just begin to show you this. We'll be working on this, and I know you'll be working on it with this judge this week to refine those numbers and maybe have a not as cluttered, maybe an easier way of
Yeah, we'll
showing
work
it.
on it. But the other thing is, in addition to this for the registrations, more importantly, we need one of these for the vaccines, and we're gonna have to go about finding ways to get, you know, I think one of our clinical partners is beginning to take a little bit more seriously maybe the need for reconciling with the state.
Yes, sir.
Because we've been told that we're not getting as many vaccines because they think we've got vaccines sitting on the shelves, and I don't believe that, because in just talking with the folks who've been giving this, we don't have vaccines sitting on the shelf. I believe that the system that the state has, the data collection system that the state has, is archaic.
Yes, sir.
And it is basically costing us vaccines. And, you know, as I've said before, this week we got about 24,000. Dallas got about, well, Denton got 25. Collin got about 33. Dallas got about 50 to 51. And Harris County got 84. I'm sorry, that's not acceptable. It's not anything, you know, it's not anything as a result of anything we've done. It's the state, and we just need to raise a little bit more cane, and we're going to do that.
I agree with you. We should, and I'll be happy to provide any data that we have that bolsters our argument, because as you can see on the scheduling chart, I'm idling clinics, sort of running half days. We don't have enough vaccine to run them full day.
Yeah.
Yeah.
Well, I appreciate you for walking us through that. I made a lot of notes, the arrows and all of that. So I think I followed it, but I'll
Yeah.
call you if not.
It'll change between now and next week.
Yeah, that's a great point.
Trust me, I was pulling my hair out. I was like, and I have to explain this tomorrow? Good luck.
Yeah. One of the things that I wanted to ask about, not related to this data, but about the variant, you mentioned Italy and UK and India. I heard a news report about, I guess, the increase in positivity rate, the third surge in Italy. The same story had mentioned some of the concerns about AstraZeneca, which I know that has not received approval here, but kind of what's the latest that you've heard from AstraZeneca in the States?
So I believe they're making their way to submit data to the FDA for approval.
But they got held back. I heard this morning that at least in some of the European countries, they've stopped it.
So temporarily, some did stop because there was a news coverage about somebody having blood clots after receiving the vaccine. But I did see follow-up coverage that they got clearance that it was unrelated to the vaccine. So hopefully they'll be back on track. I believe Canada had temporarily stopped as well, and they're now back on track on using AstraZeneca.
Okay, I hadn't seen that follow-up. So okay.
And there's other vaccines that are making good progress. Novavax, I think, presented results and look very promising. Of course, they'll go through the process with the FDA and so forth. So there's going to be multiple options here soon.
That's all I had. Thank you.
All right, thank you.
Sites, one more thing on your site. I know we saw the announcement this morning for the Stop 6 site. Just want to reiterate on the record, the next site needs to be in Northwest Tarrant County. So UNT, whoever it is, we need to convey to UNT that the next site will be in Northwest Tarrant County.
Yeah, we've asked UNT to be in court next Tuesday and to talk about two issues, site locations and also messaging. So we'll get a report from them at that time.
Yeah, but I don't want to see between now and next Tuesday a site open up someplace other than Northwest Tarrant County.
Yes, sir. Thank you.
So just very briefly, and we're still working on this. I know that Mr. Schaffner had sent you all an email the other day, or a memo, dealing with the American Rescue Plan Act. And we've included that in your court communication. Don't really want to get into too much discussion about that because we're still waiting for direction from the federal government. Just some very high notes. Obviously, we're going to be seeing some additional funds that are going to be for housing assistance. Public housing is going to be there. There's money in this fund for mental health related activities. There's going to be some business stimulus programs that are going to be funded, and just a whole slew of other things that are going to be part of that $1.9 trillion package. I guess the one thing that I would like to point out to you is that there is a physical assistance to both state and local governments, and you'll find that, I believe, on the last page of that memorandum, section 9901, that talks about how much money the states are going to be getting. That's about $219 billion, almost $220 billion. The municipalities and the counties are also going to receive some money. There was funding of $130.2 billion in this fund for cities and counties. The split is for both metropolitan cities. Metropolitan cities are considered cities that are available for HUD money, CDBG funds. Cities that are not what they call non-entitlement cities. These are cities, we have a lot of these here in Tarrant County, but every city in Tarrant County, I believe, is going to be receiving some portion of that. The counties, about $65.1 billion that are going to be made available to the counties. Judge, your recollection is about 410?
We're going to get just slightly under 410 million, half within 60 days, and the other half within, or right outside of a year, no sooner than a year after we get the first check.
So we are going to receive those in 2 tranches, and as the judge said, 60 days after enactment. So we'll be waiting for that money. It'll be deposited directly into our accounts, and then 12 months after the first tranche, we'll receive the second tranche. What we did include in there in this memo was 6 bullets that talked about some of the money, how the monies could be utilized. You know, one item, we cannot use it for any pension fund activity. We had never intended to do that. Our pension fund is very solid, and so we'll not have to do that. There'll be money for a lot of activities that the county does. One thing I would like to point out, though, is that of this $400 million that we're going to be receiving, the monies that we get for housing, that we get for mental health, that we get from all of these other activities, rental assistance programs like that, are not part of that $400 million. That is in addition to the $400 million. So there'll be substantial monies that you'll see. The act that passed in December, I think it was a $900 billion act from Congress. We've received $24 million of that in the emergency rental assistance program that we're running now. You're going to hear a bigger report on that next week. And so we're still waiting for some additional guidance. But now that this act is passed, we'll start picking up the planning process with the Commissioner's Court on how we're going to utilize our funds.
On the cities, I still haven't seen a clear picture that outlines. I think the CDBG cities are 50,000 and above.
They are.
Okay, is that right? Now the ones, and we've probably got 5 or 6 cities that qualify for that. The ones that are below that.
Euless, Grapevine.
North Richland Hills.
And North Richland Hills, again, Arlington, Fort Worth, and those are solely within Tarrant County. And then also Mansfield and Flower Mound, which
And
are
Grand
partially,
Prairie.
they're above the 50,000.
And Grand Prairie would be the other one.
Now, there has been a document that has shown how much the other cities, what we call the non-entitlement cities in the county, a listing of how much each of those cities are going to receive also.
I'd like to get that, because I wasn't sure. The question with regards to those non-cities, non-entitlement, is whether or not that money goes to the state and then comes to the city, or whether it comes straight to the city. I'm afraid that may go to the state first, which may.
The state there's monies that pass through the state to go to the local entities. They have a short window to get that money out. They just have to distribute that. I don't know if it's going to go directly to the cities. That's something we can check out. I mean, we're still learning a lot about this bill, but the information that we've seen, there are specific dollar amounts that have gone to some of the smallest, even to the larger cities that are non-entitlement cities.
I want to really stress the fact that if it had not, now we got a direct disbursement for the first CARES Act funds because we had a population of over 500,000. But I want to stress, not for us, but just for everybody else, if it hadn't been for NACO, that direct disbursement to the counties would have been much smaller because they wanted to make it all pursuant upon the CDBG, which would have meant instead of getting 50% of the 130, we would have gotten about 17%. And also, they took away all the floors, and so even Loving County, with somewhere around 100 people, is getting $33,000 from that perspective. So again, if it had not been for NACO, we would first off not have received near as much money, and secondly, we would it would have probably gone, it would have definitely gone through the state because the state was really trying to, or all of the states, not just Texas, all of the states were trying to get that money to go through the governor.
Yeah, it really helps that it's coming to the
tend to take an administrative charge rake off when the money goes through their hands first.
Well, in the last group, basically in order for you to qualify for your money, you had to spend 75% of it on COVID-related expenses, everybody had their businesses closed down. Not everybody had a COVID case for the first 3 or 4 months.
That's true.
It creates greater flexibility when they hand it down to the local governments. That's all we have on item 1 in all of our section.
We have one speaker. It is Mr. Robert Bucher, and if he'll come forward at this time. Commissioner, I'm going to step off just for a second, so if you'll let him, get him going. He'll be in shortly.
GK, can you control the clock?
I do control, yes, sir.
Good morning, Mr. Bucher. You have 3 minutes.
Yes, good morning, how are y'all? I just want to kind of speak on the current mask policy, just for the county. Many of my coworkers, you know, from one side or the other, from my side of the jail to the Tarrant County side of the jail, you know, I know they can't really speak out, you know, and I'm gonna kind of be a voice for them, because where I work out kind of gives me the leeway for that. They're ready to take the mask off. They've had about enough. It's kind of hard to, you know, wrestle a combatant that comes in wearing this mask, because when it gets hot around the mouth, you tend to lose more oxygen. And I mean, I've experienced it myself in the last couple of days, when you have somebody that come in that's not compliant, that's not trying to hear anything that you're trying to say. And it's really hard for them, you know, as well as myself, you know, to go through that, which, you know, the last thing we want to do is ever have to wrestle one. You know, we'd rather, you know, verbal judo it out, and, you know, and works out for everybody. But sometimes it's not the case. And so, I mean, we just need to be done with this. I mean, I know that Mr. Fix had asked that question last week, and, you know, I applaud you for asking that. Thank you for speaking out. I mean, I know sometimes it's hard, you know, but, you know, eventually you get fed up, and sometimes we need to move forward. You know, we got the vaccines coming out for the ones that want to take it. Let them take it. You know, personal freedom, personal choice is what's something I've always stood on. If you want to take it, I'm not going to go out there with a sign of protest. I'm going to say, hey, that's your choice. I welcome you to it. You know, I'd actually, if you feel like, you know, that's going to make you safe, go for it. All for it. I'm all for that. But at what point in time do we say, you know what, let everybody in this courtroom, everybody in this administration, you know, have their chance to say, I want to keep wearing it or not? When do we stop? When do we say, you know what, it doesn't matter if, you know, we go to a spring break. What's the difference between sitting at the house for, you know, 2 days, going to school 3 days, or going to a hybrid class and coming back? Who's to say you'll never catch it or not? It's the virus is just what's going to be. It's either going to catch you or it's not, mask or no mask. I got it wearing a mask at work, and I got it from somebody at work, and I had to, you know, pay the price for it. But I still got natural immunity, and it worked. So at what point in time do we give us personal responsibility? At what point in time do we do that? I know Mr. Wilder came up here and spoke about wearing the mask, and people coming in, and judges and everything else don't need to sign warrants or affidavits or whatever it may be. And he's one of the many people that I've seen without a mask in many pictures that I presented forth to y'all. So at what point in time do we give everybody personal freedom? When do we do that? When do we say, you know what, from the county judge on down to the everyday secretary, you know what, if you want to wear the mask, fine. If not, fine. So when do we do it? Because it's not going to make a difference whether we go to spring break or not. Because when we come back, either way it goes, Vinny's either going to up the numbers to 200 to 500, like he has been since day one, and skewing them for his own personal gain, whatever that may be. But at one point in time, do we just say, you know what, let's do this? That's all I'm asking for.
Thank you.
Thank y'all. Y'all have a good day.
Mr. Manius, again, there's no action necessary for your...
Not at this time, Your Honor.
Okay, Human Resources. Mr. Wyman.
Move to receive and file the personnel agenda.
Second.
We have a motion to second to receive and file the personnel agenda. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Good morning. It's still
Good
morning.
morning.
And thank you. We have two additional items for the court this morning. They are both requests for changes to table of organizations. The first comes from Judge Newell from the 233rd District Court. He's requesting the creation of two new positions for his organization effective March the 17th. Specifically, he's requesting an associate judge as well as a bailiff. Both these positions will handle his CPS cases. There will be an impact to the general fund of approximately $282,150. That does include fringe benefits.
I'll move approval. Second. A motion is second. Any discussion? Please vote. Commissioner Johnson?
Yes. Yes.
Motion passes 4 with 4-0 and 1 abstention.
And then again, our second request for table of organization change comes from the Sheriff's Department. The Sheriff is requesting the addition of 50 additional detention officers, 1 lieutenant's position. If approved by the courts, or by the court, these positions will be effective tomorrow, March the 17th. There is a cost to the general fund of approximately $3,442,471 and some change. That does include fringe benefits. There are monies in reserves to handle this request, and I believe the sheriff is here if you have questions for him.
Let me make just one comment. We've been working with the Sheriff's Department on this request, and you might remember last week we provided 7, and we believe that this is a good request, and we're going to be, the staff is going to be highly supportive of this. We're running a tremendous amount of overtime within the jail. The sheriff has declared an emergency under the statute so that his jailers are working 6 days a week. And we simply need to provide some additional relief, and we believe that this is going to be a good start in getting that relief. Our jail population has continued to increase, and we have not provided additional staffing in the jail for some time now. So our request is that the Commissioners Court approve this staffing request.
And I'll just state that we've gone from about 3,600 to around 42, between 42 and 4,300. For the longest time, the state was not taking prisoners into the prison. We have 200 plus, as I mentioned earlier, folks waiting for either to reach
Competency
restoration, as well as are waiting on for state beds. And we have probably 100 plus that are waiting on, that are there for blue warrants. They violated parole, and we're waiting for the parole board to do something. So that again doesn't, I would hope that eventually the state will clear those out, but we have no guarantees, and the folks in the jail have been working tremendously hard. So we really need to, hopefully we really need to do this and get this done.
I move approval.
So, he just moved. Second. We have a motion, a second. Any discussion?
Is there any offset against this $3 million by savings and overtime costs? Or?
Yes, currently we're at a burn rate of about $8 million in overtime this fiscal year. And Chief, it might have increased a little bit more as we talk, but that will decrease some of the overtime. Hopefully we'll get to the point where that our detention officers only have to work 40 hours a week. That's going to help the overtime aspect.
And will also help the morale.
Yeah. Absolutely. Absolutely.
Sheriff, is there anything you want to add at this time?
Thank you. First of all, I want to thank Tina and GK and his folks for working with us on this. We are at a crisis in the jail as far as our people and battle weary. And this is a great start. And, as the judge articulated there is, we've got about 400 prisoners that we probably shouldn't have. I mean, they're either the state or heading to state beds. And, you know, the courts are still slow because of the COVID issues, and all of those backups has put us at the tip of the spear and the brunt of it. So our guys are working hard, and they are working 6 days a week, and they're doing everything we ask them to do, but we've got to give them some relief, and this will certainly be a good start.
How long is it going to take you to staff up and train up so that the detention officers who are currently working such long hours can feel some relief?
Well, good Lord willing, the creeks don't rise. We're hoping by August 1 that we'll be there, and we're working very vigorously. We hope it's earlier, but I want to be realistic in recruiting and putting people into service. Currently, you know, we've I think as of this morning, I only had 5 jailer openings on our turnover rate. We did have those 30 contract positions in the jail, but we were having a very difficult time recruiting anybody that wanted those. We couldn't find people for those. So if we go to a full-time employee, then I think that we'll fill those. We have, I was told also, Friday afternoon is that we do have people waiting in the wings ready to apply. So the sooner that we get people in, the sooner we're ready to run double classes at the academy or whatever it takes to get this as quickly as possible. But we have the entire sheriff's office is running just as hard as it can in every direction to fill these holes.
Any other questions? Please vote. Motion, Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
And Sheriff, later this afternoon, would you please give me a call?
Is that me, sir?
Yes.
Yes, sir.
Yes, sir.
Thank you.
God voice.
Vinnie?
Public Health has 2 items for your consideration this afternoon. The one is a request for approval for the Tarrant County Public Health Preventive Medicine Clinic. That's our HIV clinic to purchase gas cards as incentives for people to make their visits.
Move approval.
Second?
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. Second request is a request for approval to submit a grant application to DSHS for our COVID emergency response efforts. This is focused on vaccine efforts. I believe the competition amount was $120 million across the state. We're going to put in an application seeking about $12 million. I'm not quite sure what they will approve, but that's our goal, and we're requesting your permission to submit that application.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Thanks, Vinnie.
Thank you.
Melissa?
Good afternoon.
Good afternoon, Melissa.
We have 2 items for your consideration. The first item is an award recommendation for bid number 2021-031. This is an annual contract for urine drug screening and supplies for Cscd and juvenile services, awarding to the primary SmartOx and the secondary next gen monitoring per unit price.
Move approval.
Second?
We have a motion and a second. Any discussion? Okay, I got a couple of texts up here about somebody who hadn't paid taxes. Is that, we're okay? Next week? Okay.
No.
Go ahead, Melissa, and explain whatever you want to explain.
Okay, that's the second item.
That's the second item. Well, then we don't need to worry about it right now. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Now the second item.
Okay. The second item is an award recommendation for RFQ number 2021-052 for appraisal services for transportation services, awarding to the various vendors listed in the court communique per contract terms. And yes, there was a vendor Collier International that had outstanding property taxes. He was notified over a week ago, and we've just been going back and forth, with the gentleman and referring him to the tax office. And as of this morning, he still hadn't paid.
And his name is not on this list, right?
No, he's not on the list.
Okay, well, that's what I want to be sure of.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Commissioner Fickus?
Yes. Have an interlocal, 14 streets, City of Fort Worth. Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Are there any appointments today? None. Then you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. I don't believe we have any other, got some items for.
Just one additional item, and as one of the briefing items, we continue to have updates regarding the 87th regular session of the Texas Legislature. Mr. Schaffner has provided a memorandum to you, and I will try to answer any questions you may have as it relates to that, or you can simply contact Russell and he'll brief you individually.
Any questions? I would say that we're looking, Senator Betancourt, which will give you an idea of where we're going with this before we ever get to it, has presented SB 10. SB 10 is the Senate side of the taxpayer lobby, and basically says that if somebody qualifies, Russell, for example, is our person, if he spent more than 26 hours per quarter, then we can't employ him, or he cannot be doing that anymore. So in effect, elected officials can go down and stand, and sit and wait for them to get around to us if they do.
All day long.
But other than that, and it only applies to cities and counties. It doesn't apply to schools. It doesn't apply to any other state agencies. And it doesn't include the over $60 million that they spend with the federal government. TxDOT just issued a $12 million contract for lobbyists, and there's no telling how many employees they have that are up there spending a little bit more than 26 hours per quarter lobbying the federal government on behalf of that. So they don't mind spending taxpayer dollars for that. And again, I don't question the legitimacy of that, but it's the same with us. Most of the work that Russell does is to try to help move, as bills are moving through, to make sure that we can efficiently and effectively execute those bills should they pass. And to take us and to ignore us and leave us out is ridiculous. And so are the ads that we're hearing frequently on the radio by the Texas Public Policy Foundation.
Empowered Texan.
Empowered Texan, because Tim Dunn, who finances Empowered Texans, is also either the vice chair or on the board of the Texas Public Policy Foundation. So,
Judge, that also includes us communicating with administrative boards with the state.
yeah, we can't call down. In fact, as I heard it this morning, if you're just trying to introduce yourself to someone new, you can't even do that without it being a part of the 26 hours toward the lobbying effort. So
the Texas Transportation Commission is, that's something that this court is actively involved in transportation. So the communications we have back and forth with them, even trying to partner with them, could potentially fall under this bill. And it would simply cripple a lot of the programs that we do.
Vinnie couldn't talk to Imelda, couldn't talk to DSHS. That has reached the extreme, and that is,
Think about
ridiculous.
our law enforcement people talking to the criminal justice division, that would be limited also.
I would like to see this court consider a resolution, a policy resolution in favor of the broadest exercise of the voting franchise possible, rather than all of these attempts to narrow and exclude and exclude. I'd like for us to be on record in support of people's right to vote.
Commissioner, would you talk with Russell about that and see
I
what he can
certainly
do
will.
toward that effort? Anything else at this time?
Not at this time, Your Honor.
Then we'll recess our open meeting to proceed to close to discuss items exempt under section 551, Form 071, 072, 074, 076, and 087 of the Texas Government Code. Having returned from closed session, there not being any business to conduct at this time, we stand adjourned. So moved.